Hello everyone, it's Tuesday and you're watching Within the Frame. I'm Kim Bo-kyung. Daily COVID-19 infections are continuing to surge with 50,388 reported per day in the first week of August, a more than 10% increase from the previous week. Now, due to the uptick, health authorities have decided to postpone classifying COVID-19 at the same level as the seasonal flu. COVID-19 is not the only health concern South Korea is dealing with. Heat-related illnesses have led to the deaths of around 20 people, while seasonal flu and respiratory illnesses are making people suffer from symptoms of cold. To discuss health issues people need to be aware of, we invite Professor Kim Moon-kyu from the Yonsei University College of Medicine. Professor Kim, welcome to the show.
Thank you for having me.
Thank you for being here. Now, first question. Daily average number of COVID-19 cases has been increasing for 6 straight weeks. Why are we seeing such resurgence?
Well, primarily we ease the quarantine measures, so that will be one of the reasons. And through this pandemic, we experienced some kind of a surge in summer times. That's common for almost every year, and we might consider that most of the people are in air conditioning and crowded places, and that can be another reason that people might be exposed to this coronavirus. Excuse me. And during the times, there are newborns who are not infected, not even exposed during the pandemic. So as I work in a pediatric emergency department, I see young babies, like a few months old. They were never born during the pandemic, so they got infected. And also among the adults or teenagers, we see patients with reinfection. Maybe because even though they had infection, the immunity started to wane after a few months. So there might be a new cause of new outbreaks. Well, we have to think about a new variant in this situation every time, because this coronavirus, very easy to make new variants. And if the new variant is a subvariant of Omicron, I think that it's not a big concern, but still we have to monitor the new type of mutations happening among populations.
Right. Since our Professor Kim talked about the new variant, the new subvariant, I'd like to delve a little bit deeper about this. So the new Omicron subvariant called EG.5 is reportedly responsible for more than 17% of the new cases over the past 2 weeks, according to the CDC. Now, what is this new COVID-19 strain and how dangerous is this?
Well, as I mentioned, if it's some subvariant of Omicron, we can review the subvariants of Omicron in the history, and thank God that none of them was that dangerous. So if it's still that kind of pattern happens, we have to watch carefully, but I'm hoping that it will not increase the mortality rate, even though it can have a high transmission rates.
Right, so it could have high transmission rates, but it will not affect the mortality rate that much.
That's my hope. Yeah.
All right. Now, Professor Kim, due to the resurgence, South Korean health authorities decided to postpone the plans to downgrade the infectious disease level of COVID-19. Now, when do you believe the timing would be right? Should it be after Chuseok holiday season?
Well, most of the Korean hospitals do not have a facility to manage 2 kinds of outbreaks. For example, if you have a COVID-19 outbreak overlapped with influenza, that's a very, very difficult situation. And if you want to manage that, every patient visiting hospital should be stayed in an isolated, a private room, not a room with many beds. So we cannot deal with that kind of situation. So I think it's better to focus on some high-risk groups, like elderly people with underlying conditions, such as cancer, lung disease, diabetes, obesity, etc. And those people still can get really sick if they are exposed one more time to COVID-19. So those people should be really careful wearing masks, hand washing. If you meet somebody or go to a wedding party or whatever, has to be very cautious about that. And I hope that before Chuseok, we should solve one of the problems. Maybe influenza should subside, and maybe COVID-19 should subside also. So Chuseok is another big holiday, making people gathering around. And I really hope that we should not have another new variant emerging out of COVID-19.
Right, so either flu or either COVID-19 should subside so that we can handle the patients.
Yes.
All right, I see. Now, why don't we ask our fourth question to our Professor Sohn? We did not have a chance to introduce our professor, who is an associate professor of preventive medicine of Seoul National University. Welcome to the show, Professor.
It's great to be back.
All right. Well, Professor, if the infectious disease level of COVID-19 gets eventually downgraded, though we do not know when that's going to happen, what changes will be made?
Yeah, so the major distinction right now we have is that it's from level 2, and the proposed downgrade is to level 4, is that the major distinction is that the mandatory requirement, individual reporting of new cases within 24 hours. And right now, those who are individually infected or are contacts of infected persons needs to be quarantined. At level 4, all of that goes away. So there's no mandatory requirement for reporting infected individuals, nor quarantining. What happens for level 4, which are influenza viruses, for example, is that there's a population level surveillance. So there's going to be a sampling of individual patients out of our entire population to monitor and surveil the levels of the infection in our society. So that's really a significant change when we go down to level 4.
Right, I see. Now, staying on the COVID-19 front, Professor, though the World Organization of the Scout movement, expedited the departure of all participants from the campsite due to the typhoon coming, the activities are reportedly going to continue in Seoul and surrounding areas. Now, given that the participants are usually in large groups, what kind of preventive measures should they take?
Yes, it shouldn't be so different from what we've been practicing over the last 3+4 years, right? That any congregate settings is a plain recipe for highly transmissible epidemic setting for COVID or any respiratory illness. So social distancing, obviously, is the most important measure. Obviously, that's going to be very difficult. What we need to think about, and if the camp organizers need to think about, is that anyone who's been infected or has symptoms of respiratory illness should first start wearing masks, right? And then I wouldn't go all the way to quarantining them, but isolate them from group exercises. And then basically the other way to keep that levels going down in these congregate settings is to keep our sanitary personal hygiene measures up to the most highest level, right? So keep washing your hands, wearing your masks, and then carry your sanitizers and so on.
Right. Basic rules are sometimes best policies.
Yeah.
All right. Well, Professor Kim, I'd like to also tap on heat-related illnesses. So as the heat wave continued, it is causing illnesses and a lot of deaths. And as a result, the official heat-related death toll has already exceeded last year's. What types of heat-related illnesses are there, and what are their symptoms?
Well, there are many symptoms, but if you are too much exposed to sun, you may have a heat exhaustion, and you can have a sunburn on your skin, and you might have some headache because of dehydration and other symptoms you might have it. Well, I don't see this kind of patients a lot, but since I had a chance to join the Saemangeum Jamboree for 3 days as a voluntary doctor for the clinic, I really saw a lot of cases of heat-related problems, and that area is sandy and very hot and humid, and they have a lot of activities during daytime and even during the evenings and nighttime. And they are young and very energetic, so they don't care about their condition, and suddenly they collapse.
Oh.
I think that kind of thing happened during the first few days of that camp. And well, still, most of the participants were happy, as I can say, because I tried to ask them how they feel, and you know, they have almost all of them have some bug bites on their legs, but still they're happy, they're really enjoying. In addition of symptoms that I mentioned, they have some kind of contact dermatitis, because there are many grasses that contact with skin and become very irritant and painful. And during the nighttime, they even have some sore throats and coughing of the weather change, because of the weather change. So when we visited there as a member of 18 doctors and nurses and every personnel, we prepared a lot of intravenous fluids and many kinds of medications. But well, most of the students improved just staying in the air-conditioned room, like in the clinic or some buses that served as a air conditioner. I think the weather was much worse than they expected, and I think they prepared for the bad, but was not for the worst. So many students got a problem. If they come back to cities like Seoul, I think they don't have to worry about those things. But I also saw many COVID-19 cases among the camp, and most of them were never infected during this pandemic. So I can tell that the participant of this camp, if they know that they have never infected with COVID-19 during this pandemic, they're going to catch COVID-19, because they're not going to keep distancing. All the activities is group, is in group. So they are the most people should be cautious.
Right. Well, based on our Professor Kim's experience as being doctor at Saemangum Jamboree, we have been talking about how participants had to go out on the fields and get some kind of heat-related illnesses, but usually those who get heat-related illnesses are those who are at the construction sites, and of course those out on the fields without shade, like you said. Now, what precautionary measures should they take?
Number one, water.
Water.
So during hot weathers, you have to sweat to cool down your temperature. And you can notice it, but sometimes you cannot know that you're already getting dehydrated. And you check your urine output, and if its amount is small, very concentrated, it's an alarming sign. You have to drink more water than that you think. So I recommend every 5 minutes or 10 minutes, try to drink some water as often as you can, and avoid direct sun exposure if you have to stay outside as a long time. And enough balanced food, and in between those working hours, you need a resting time. As I saw many buses in the Saemangum Jamboree camp, that cooling bus is very effective to prevent heat exhaustions, and sometimes fever, and you can even have fever, and you can have headache and with vomiting. Those kind of symptoms continues, you better see your doctor before it gets worse.
Right, so basic rules are drink a lot of water, stay within the shade, and have resting time between your activities.
Yep.
Right. Now, Professor Sohn, I'd like to also talk about flu. So the number of flu cases is still high as well, and according to the data, the cases stood at 15 per 1,008 patients for the last week of July. Now, as far as I know, seasonal flu peaks in winter and fades away. Why is it still on the rise?
Yeah, so let me first kind of correct, not to correct what you just said,
right.
but the indicator you're mentioning, I think you need to have a clear reference. It's actually flu-like symptom outpatient visit numbers, right?
Oh.
And it's one of the monitoring indicators for us to look at, you know, what the trends in flu and other viruses, viral illnesses circulate in our society. There are a couple of hypotheses, obviously. This summer surge and summer waves of flu has been seen in the U.S. previous years. And then they're sort of expecting it this year as well. We're seeing it this year. One of the hypotheses is that there's a lot of pool of susceptible population now because we've been so adherent to social distancing and mask-wearing policies, so that the influenza that's been circulating has not been able to infect us as much. So we have less and less people who've been previously exposed. So this sort of is particularly surging this year. And because there's a lot of travel, a lot of interactions and group interactions and movement, that's much more than so since we've entered the pandemic. So that's another recipe for high transmission rates for flu. The second issue is that the indicator you mentioned, the reason I corrected is because a lot of other viruses that's circulating in our society during summer months are adenovirus and human para-influenza viruses. These also have very similar symptoms, classical symptoms like cold symptoms, but also very similar symptoms to flu. So people have been exposed to that, and we have some data indicating higher levels of those viruses circulating in our society. So therefore, there's a lot more outpatient visits related to those symptoms. So that's what we're seeing right now.
Right, I see. Well, we'll come back to the other respiratory illnesses that our Professor Sohn could talk about. But before that, Professor Kim, those with flu symptoms are concentrated mostly among, children and adolescents aged between 7 to 12 and 13 to 18. Why are people in that age bracket more vulnerable than other age groups?
I don't think they are more vulnerable in immunity. They are young and healthy. But during those 3.5 years of pandemic, they had to spend their, time. It should be very active, but they were kind of kept in some at home or they were limited activities only. So this year might be the first year, they enjoy junior high school years, and they had vacation, now in vacation. So there are many activities among them. I asked students when the patients who visit the emergency clinic, what did you do? Why did this happen? And I get the answers. They are really crazy to play, enjoy their times, and also they have to study. Even though after school they go to the institutions, have to study on air conditioning situation in a crowded space. So they share all the viruses together. If one gets sick, the other's gonna get sick also. They really enjoyed to go crowded areas with friends as a group. So I think this kind of pattern might continue for a while.
Right, I see. So it was mainly because of increased amount of activities.
Yes.
Right, I see. Now, Professor Sohn, so let's go back to respiratory illnesses such as adenovirus and HPIV that you have talked about. What are symptoms of those illnesses? How are they different from flu?
Yeah, so actually, in terms of symptoms, their initial symptoms are not so different, right? A lot of them carry most of the common cold symptoms, obviously, same with flu. Some of the details of the symptoms may be a little bit different. But again, I think especially for adenovirus, right, where it can infect essentially is the difference. And adenovirus compared to HPIV or flu, it can infect the cell lines of your eyes, intestines, and therefore give rise to pink eyes or diarrhea. So if you see those type of symptoms, they're a little bit different than maybe HPIV or flu. But generally, overall prevalence of the symptoms are really similar. So that's why it's really difficult to distinguish whether or not I got a COVID or flu or these other viral infections.
Right, I see. So in that case, do we have to go to doctor's clinic and get tested to see what exact illness I have?
So the rule of thumb is yes, but it's really going to be difficult for certain, if it's COVID, I think it's important to get treated. Especially if you're over 65, there are treatment options like Paxlovid. For HBIV, it's a little bit more like home therapy and other things, unless it gets to the level of pneumonia and more serious respiratory illness. That's when you have to get a lot more intensive interventions. But most of these symptoms resolve within 5 to 10 days. So it's more about how you become more precaution about and monitor your status before you actually seek, and also making sure that you don't infect others around you.
Right.
So therefore, wearing a mask is very important.
All right. Well, Professor Kim, I believe this would be our last question. So what are there any precautionary measures that we can take to prevent, respiratory illnesses, COVID-19, and seasonal flu?
I think Professor Sohn mentioned all the important things. So I would like to add a few more things about the children. Children are not the high-risk group for COVID-19, so we don't give any special additional medication for them, just as same as other simple flus. If you get influenza, we can give you some medications for that situation after the test is positive. And there are some viruses causing respiratory symptoms and gastrointestinal symptoms like vomiting, abdominal pain, diarrhea. So they're having both, coughing with vomiting and diarrhea. So why this happen? Because of the water activities. They go to pools and fountains, they play. They get crazy, and suddenly they are exposed to water. They go into their mouth or mucosa. So we see a lot of cases like that. So I would like to say that you should not drink accidentally, drink that. And if you get too tired, you get a more high possibility to get sick. So as I mentioned, need some resting times. And I tell the parents that they need some resting times between those activities.
All right, I see. Well, let's hope all of us could keep ourselves safe from all these illnesses, all right? Well,
Yes.
Unfortunately, this is all the time we have for today's edition. Thank you, Professor Kim, for your insights. And of course, thank you, Professor Sohn, for your time and your insights. We really appreciate it.
Thank you.
All right, that's all for Within the Frame tonight. We'll be back tomorrow with more in-depth stories. Thank you for watching, and goodbye.